Hi, I'm Dr. Rajani. Thanks for joining me today. We're talking Kybella. There were a lot of questions on, can you use it on the face? Can you use it on the jowl? What's the dose? It's Buccal in Canada. A lot of Europeans on here. I love learning. People send me all different formulations and they're saying a lot of DIYs, do-it-yourself people. They send me the name of what they're using. A lot of Korean stuff. I look it up. Some of it has additives such as carnitine, which is a skin tightener, collagenases and different things. There's all kinds of cocktails, especially in Europe. We're going to cover a plethora of things today about fat dissolving. We talk about the Korean V-line slimming. Should it be used for that? Some of the pitfalls. Do you need to use the grid? There's a lot of stuff on Kybella. And we're going to look at the before and after picture, talk a little bit about expectations. Should you do it? Have you did it? We're going to dive in 3 seconds. Okay, Kybella is sought after. It's a little bit expensive in the United States. There are other versions. A lot of people talk about compounded versions, or what are they using in lipo-dissolved cocktails. Remember, if you like the videos, click like. Really helps the algorithm. I can bring more videos to you. Subscribe, become part of our family here. We're going to continue to bring videos, talk about angles, talk about all kinds of factors that allow beauty to be created safely. What are the newest products on the market? And there's a search bar here. So if you're looking for masseter hypertrophy, facial slimming, glass skin, Fraxel, high frequency ultrasound, it's all here. Search, and we can always update the videos. Now, if we talk about Buccal in Canada, Kybella here, Kythera Pharmaceuticals started to make it commercially available as Kybella. It was bought by Allergan, now owned by AbbVie, and it comes in vials about 2.2 mLs. It's deoxycholic acid, a bile salt, a secondary bile salt. Now, what it does, it disrupts the cell membrane of the fat. Once you open that biphospholipid membrane, it kills the fat cell. So it is permanent. People say, well, what's permanent and why is it permanent? Understand, in effect, nothing's permanent, but those fat cells that are gone for good. Why are permanent things, such as the Korean V-line, such as facelifts, which people think are permanent, such as permanent fillers, why are they not permanent? Nothing lasts forever because the face continues to age, the bone changes, the fat changes, there is some hypertrophy and atrophy, so the fat grows and it slims. We know that to be true. That's how facial aging occurs, and body aging, collagen and elastin. A facial implant, when you put it in, yes, that's a permanent event, but say you get it in at 50. At 70, you might see the outline of that implant, which is why an implant, if you want a permanent implant, something like Bellafill as a filler is better, or better yet, something you can dissolve and change, hyaluronic acid. So when you say permanent for Kybella, yes, it permanently reduces the fat cells, and as a benefit, you only have so many fat cells. What do? They expand, they contract for a living. They expand when we gain weight, sometimes as we age, and they shrink likewise. Okay, so what the fat cells that are gone for good. There are less to shrink and expand. We now know that. Now, when you say we get rid of fat, there's also fat around nerves in the form of myelin. So the electrical impulse travels, it hops along this nerve sheath. That means that you can get nerve damage from it. Why am I bringing it up? Because a lot of people want the jowl fixed, and I have a whole video, dissolve your jowls, where I use PDO threads, a little bit of filler, but also Kybella here. I've done it for years. Yes, I've had a couple of patients that droop their smile for about 1 to 4 weeks, 4 weeks max. They all come back. Why? The myelin, the fat around the nerve cell, comes back. It regenerates. So this isn't a permanent event. However, when we're talking buccal fat for V-line slimming, that's another deal because there are different nerves, different depths, and put your tongue in there. Your mouth is awful close, and guess what's there? Your parotid gland and your parotid duct, most importantly. So be very careful, but it can work well. So one of the uses is facial slimming. So the marginal mandibular nerve comes up right where you don't want it to, where the pre-jowl is and where we want to get rid of it. That's why in the study, which had about 1,600 people, there was a 3 to 4% smile change from that nerve being affected, but they all came back. Now, the grid, let's talk about the grid. When you have something FDA approved, of which the other products are not, so the compounded versions are not FDA approved, they're off-label use for the under chin, and they aren't the exact same formulation as Kybella. They are different concentrations and often mixtures of PCDC, phosphatidylcholine, and deoxycholate. The purists, a lot of mesotherapists, especially in Europe, because that's where it really was popularized, believe that you need phosphatidylcholine and deoxycholate combined, to one to disrupt the cell, the other to go in and kill the cell. So that combination you'll see normally used, often used with vitamins, minerals, lidocaines, different things for different reasons. Dispersants to help disperse the product and keep it smooth. Those are the kind of lipo-dissolved cocktails, the Korean cocktails or Asian cocktails. And nothing bad about them. They can work as well or better. There's different laws and the ability to use different products more freely, sometimes in other countries. Not all the time. You'd be surprised some of the things that do not get approved. So if you think about the grid, yes, the grid was there so it could be studied and FDA approved in the United States and Canada. So they had to standardize it. We go off the grid regularly. Rarely do people use the grid anymore. They talked about getting modified grids so that it include the pre-jowl and so on. Waste of time. If people do this for a living and they're aesthetic providers, they know where the nerve is and they should know where not to go. And if you want the pre-jowl, it works really well, takes a few treatments. You have to know that that's an expected side effect, that you could get that droop or that when you smile, one side doesn't lift as much, so in effect a droop. Only seen usually on big smile. That's the good thing about it. So there we have a side effect from it. Now, you do get swelling and you need multiple treatments, things that people don't like, but each time you get less pain, less swelling, less downtime, and it works better because there's what? Less fat cells to disrupt, cause pain. So you need several sessions and it can make it expensive, and a lot of people can't deal with the swelling. When's a good time to have a turkey neck? For how long? Typically, to other people, about 3 to 7 days in studies. To the patient, which is sometimes more important, usually for 2 weeks, because the patient sees that it doesn't matter that no one else does. They're bothered by it. They're calling your clinic unhappy. Now, why wouldn't you go get lipo? Lipo, if you have a large neck, and I've seen large necks, people don't want surgery for whatever reason, look like surgical results, but it's not that predictable. In general, Kybella is not that predictable. And in general, you're going to have 2 to 5 vials per session, and that bore out true in the study. That's what people got. They'll tell you 3 sessions, but in general, think to get those results, 3 to 5 vials. A kit is 4, so you can expect to pay anywhere around $800, roughly, I would think, a kit. 3 sessions, you're at $2,400 pretty easily. Okay, now you avoid surgery and you can get it done in the office. There's something to that, because you walk in for your neuromodulator, boom, boom, you get that, maybe a little filler, a couple injections, you get a bit of pain and swelling. You don't have to go under the knife, no anesthesia. There's a benefit there. For many people, an opening here, and I do see it scar once in a while, and if people look from underneath, you can see there's a telltale sign. If people get keloids or scars, it's not great, but in general, Liposuction for some is what they want because they're in and out. Roughly going to be the same price. Now, skin tightening does occur with Kybella. We see it. Well, why don't we tighten the lower neck? It'll get rid of wanted fat. We want fat down here. We don't want it under here. So when you get rid of fat here, it makes the neck look older. So I do it in select cases when there's a lot of fat here. Tightens well. Liposuction, and the lasers don't add much to laser liposuction. They just don't do a lot. So you can end up with loose skin after surgery, and a lot of people end up getting a platysmoplasty or a neck lift because there's just too much loose skin after the fat's gone. So if we look here at this before and after, this is 3 treatment sessions. Think anywhere around 9 vials, and you can price that out with your provider, whatever country you're in. So you have to be willing to go through it. I'm a fan. I like it. I use it in the pre-jowl. I use it on the face. I use it on the body. I've used LipoDissolve since 2004, so I like it. It works really well. I'm very comfortable with it. Cool sculpting, a lot of people might choose to freeze it, which is good. You can do a combination. Likely you're going to want some Kybella after cool sculpting to fine tune it, but roughly it's going to be around the same price because when you add your cool sculpting cryolipolysis to it, you get there. So that's Kybella. There you go, a little bit of an update of what it is, how I use it, some of the pitfalls. Have you had it? Do you like it? Let me know. Keep your skin and body beautiful, healthy, and vibrant. Thanks for joining me.